Dr. Kanchana Wijesinghe is a board-certified general surgeon with a specialization in breast surgery and over 15 years of clinical experience across public and private healthcare. She serves as a senior lecturer in the Department of Surgery, Faculty of Medical Sciences, University of Sri Jayawardhanapura, and practices as a visiting surgeon at Colombo South Teaching Hospital. Dr. Wijesinghe is the Secretary of the Sri Lanka Society of Breast Surgeons and has published research on breast diseases.
Thank you, Mahika, and thank you very much for inviting me for this session. So I think we're going to move on from prostate cancer to breast cancer. And I would like to start off by saying Prof. Isha said that although prostate cancer is quite, it's not very common, but the real cancer-related deaths are uncommon with prostate cancer. This is completely the opposite when it comes to breast cancer. Today in Sri Lanka, the highest cancer-related mortality among women is due to breast cancer. So let's see what we can do about this. Right. So I'm sure you all know that breast cancer is the commonest cancer among women globally. This is the same in Sri Lanka. The incidence, as you can see, is on the rise. Couple of years ago, I said in similar speeches that we had about 3,000 new patients diagnosed every year. Now it's close to 6,000 cases per year, so it's on the rise. Nextly, you can see when you look at the cancers among females in Sri Lanka, breast cancer is at the very top, and it is very unlikely the other cancers are going to beat it, because if you look at the incidence of its rising, breast cancer has a very steep rise. And when you look at the age group which the breast cancer affects, this chart very clearly shows that it is common after 40 years, but you do see breast cancer in young females as well, and this is also on the rise. Couple of decades ago, we saw many older females with breast cancer, but we see younger females at a higher rate now. When we look at the WHO projection, you can see in the South Asian region, they are projecting that there will be a 50% rise in new breast cancer cases over the next 2 decades. And look at the next one. It shows that the breast cancer related deaths will also rise. So there's a dying need to do something about this. So to address this issue, I generally put this slide to show how we can beat breast cancer, and there is a silver lining in the cloud. So just like any other cancer, like prostate cancer or any other cancer, it starts from one cell, and it will start spreading locally, and it will go out into the body. So you can see we have a stage 0 in breast cancer to 4, and at the bottom you can see the survival rate. That is how well we can cure a patient once they present at a particular stage. Now what I want you to see is, if you look at stage 0 and 1, we can almost guarantee 100% cure rate, whereas it keeps dwindling when it goes to stage 2, 3, and 4. Now where do you think our Sri Lankan women are commonly? We would love to see them in stage 0 and 1, but we hardly see them. They are commonly in stage 2, 3, and 4. So how can we, not only in Sri Lanka, any woman for that matter, how can we get that woman to present in stage 0 and 1? Because mind you, we don't have a vaccination. There is no way we can prevent from getting breast cancer. The only way we can beat is by early detection, and it is clear, because if we detect early, we can give you a near normal life back. So let's see how we can do that, and what are the challenges that Sri Lanka is facing. So the World Health Organization has given us 3 targets. One is, first pillar is, we have to promote early detection. It is quite clear from the previous slide, earlier we detect, better. And the second pillar is timely diagnosis. Can we diagnose this quickly and give a proper management as quickly as possible? And let's see how Sri Lanka is faring with these pillars. So as I said, so the first pillar was early detection. And we have 3 simple techniques for that. Self-breast examination, which is something the public can do. You don't need doctors for this. And I'm sure you all well versed about this. With self-breast examination, we can identify patients we try to target to identify them at stage 1. Because most of the time, our women present with an incidental finding of a lump. When they are taking a wash, when they are taking a shower, they feel a lump. And that is a random, they feel a lump randomly. For that random lump to be felt, it has to be quite big. And they are always in stage 2 and 3. But if you know about your breasts, then you will be able to identify at stage 1. Same principle for clinical breast examination, getting a doctor's checkup annually, especially for women above 40. That will help us to identify at stage 1. But if you look at this picture, you see at stage 0, there is no lump. So there is no way a doctor or a woman can identify the cancer. And that is why we have screening mammography. A mammogram can detect a cancer, a breast cancer, even before it turns into a cancer at a very, very early stage. So that is why in the developed countries, they offer this free of charge for women roughly above 45 years of age. Now, unfortunately, in Sri Lanka, I don't see this happening for the next 20 years or so. We will not be able to offer free mammograms because we have a waiting list for even breast cancer patients to get a mammogram done. But at Sri Lankan level, I still think we can go ahead with self-breast examination and clinical breast examination and try to target to see most of our patients in stage 1. So now, as Prof. Isha said, we do in Sri Lanka have lots of campaigns. We have the National Cancer Control, we have other NGOs, charity organizations, doing so many campaigns. And I don't think, I'll hardly find a female who's not aware that breast cancer is the commonest. And they are aware about these techniques of examination also. If you look at this was a research that we conducted a couple of years ago on females diagnosed with breast cancer. Majority of them were aware about the technique. But for some reason, if you look at the numbers that were practicing, dismal numbers were actually practicing this. And this goes beyond all education levels. We are not looking at females who have failed O-levels or not gone to school. We are even looking at postgraduate degree owners not practicing the self-breast examination. And I personally think this is something wrong with our education system. For some reason, we don't expect any males, females to practically apply the knowledge. So somewhere down the line, I think we are just parroting out theory and we are not highlighting why we need to identify early, and that is to improve the survival. And also this study went on to find out, right, so the women, we inquired from these patients with breast cancer how long they stayed at home before presenting. And you can see about 50% of the patients stayed at least 3 months before seeking medical advice. So we need to address this also, because when you wait for 3 months, obviously you understand now that the patients will present quite late as seen in these pictures. So I think we as Sri Lankans have to look at the way we are setting up on breast cancer awareness campaigns. We need to see that they are practicing. No point preaching with lectures. So we went on to find out why these females are presenting late. What's the problem? And majority of them had fear of being diagnosed with breast cancer, fear of treatment. If you actually really listen to them, they are very worried about losing their breast. Because the current concept is they think breast cancer, I'm going to lose the breast. But that is not so. Now we can offer breast conserving surgery. So these kind of myths have to be dispelled. Other thing is, commonly the women put the family to the front. Their children's education, work, etc. and try to delay. So we need to address these issues. So the next pillar is, so fine, we have found a patient with breast cancer, we made a clinical diagnosis, how soon can we give the investigations, get the investigations done to a patient? So if you look at Sri Lanka, so to diagnose a breast cancer, we generally need a mammogram. We generally have about 15 to 20 mammograms to the entire country. Colombo in the public health sector. So in the government level in Western Province, we have about 3 to 4 mammogram facilities, but when we go to the peripheral provincial provinces, we have about 1 mammogram per province. To give you an example, practical example, a female patient came to Colombo South Teaching Hospital due to a connection with another healthcare worker. She was from a different province. She was given a 2 months waiting list for a mammogram. Clinical diagnosis was breast cancer. So she was diagnosed in August, was waiting for a mammogram in October. So she landed in Colombo South Teaching Hospital, got it within a week's time, and she was operated before October. Same with, as I said, same with treatment. Closer you come to the Western province or the provinces with better facilities, we give better surgical facilities, sooner surgeries, the treatments are done sooner. Further you are away, they have significant problems in transportation, financial issues. So these things make them delay their process of being treated soon, and the patients also feel reluctant to go and seek medication because of these problems and waiting lists. So 3 aspects that the WHO has mentioned to us, 3 pillars: early detection, timely diagnosis, and timely management. And I think Sri Lanka is still on the way to reach the optimum level, and we need to address these issues. Medical and non-medical all should get together and try to sort out this problem, because we, as I said before, breast cancer is the leading cancer among women, and we have a dying need to address these issues for our own women. Thank you very much.
Dr. Kanchana, that was an incredibly informative presentation highlighting key insights into breast cancer. Now the floor is open for discussion.
Doctor, but there is a 3 months delay for the patient
Yes.
from the time they found the lump to see you. Do you think is this something to do with your cyclical changes? Because, I mean, we have, during menstruation with different phases, we feel the knot, or like we feel like we have a knot, and then we don't. But how can we differentiate that, to a breast cancer lump? Because every time you feel like then you have a cancer, then you go to the doctor, then he said, no, it's just your cyclical thing. Then after that you become, we don't want to check it. You're shy to go back because of this. So I think I've heard of it a lot, but what's your solution for it?
I think that's a very good question, because when we advocate self-breast examination, we always tell that if you are a female who's having periods or menstruation, please don't examine your breasts just prior to menstruation, because we know, all females know, the breasts are very tender, nodular, lumpy just prior to menses. You start examining your breasts prior to menstruation, you'll have to go and visit doctor once a month. So you have no choice. So we clearly mention, if you're examining your breasts and you're having periods, you have to examine your breasts 1 week after menses. And if at that point you feel a lump, you need to get yourself checked. And it's okay to get ridiculed. Go and get yourself checked. Your health is your investment.
I have a little question, Kanchana. Now, you said that, people, they know about breast examination, but they don't do it. So, this is just a little example. There was an organization called Mituruela. They used to do this breast cancer education. And they used to take these public health midwives and get them to examine the women who come. And they find 3 per session with lumps, 3 people with breast lumps per session. So is there a way of doing that? Taking the mountain to Muhammad and, literally sending, when they come for other things, getting themselves checked.
Yes, we've tried that, at least to take a small hill to Mohammed. We've tried to get the midwives to go and check the breasts, especially when they encounter them during certain, when they are screening for pap smear and etc. The thing is, the midwives are already inundated with work, so it has worked to a certain extent, but I think the females should take responsibility of their own health. We can't take that issue away. They have to do self-breast examination. The moment we hand it over to somebody, the females will think, right, I'll wait for my midwife. So I think it's we tried that, but we failed.
Thank you, Dr. Kanchana.